It's easy for a nurse to feel like they have to do everything because a lot of times the expectation is to do almost everything. I remember working at a place where the housekeeping union, they somehow they don't have to clean up bodily fluids. So every time there was urine or feces on the floor, the nurse had to clean it up. The housekeeping can clean up everything else, but then the nurse had to clean up um, those substances on.
You're exactly right. And I think it's important to know the why on them because it does seem like housekeeping doesn't have as much of a hand in cleaning the hospital rooms as I had thought they would. But when I learned some of the whys on them, I understood the why. Now, should it be a nurse's responsibility?
Mhm.
I don't know, but I do understand that they don't have as much medical training and
Yeah,
knowledge
yeah.
as we do, and that's why they sometimes want the nurse to be involved in that. Something as simple as stripping the room, right? When a
Mhm.
patient leaves, before a housekeeper will go in, a nurse has to go in and strip the room. We have to take the sheets off, and I would always say it's not a hard task to take the sheet off the
Yeah.
bed. Why can't a housekeeper do that? But when
Mhm.
I learned the why is because they're and there could be patient belongings like dentures,
Right.
things like that in the bed, which again housekeepers could thoroughly look for. But unfortunately, somewhere somehow a stillborn baby was left in a room on a stretcher. And when the family had left, they were in grief. They didn't tell anybody that they were leaving, and they just covered the baby in a sheet. And when the housekeeper went in, they just took all of the sheets and unfortunately threw out the baby with the sheets or with the trash. We're not really sure. Um,
Wow. That
so
is wow.
so that's the why of why housekeepers are no longer um, qualified, if you will, to strip the room. They want a medical professional to go in and make sure that there's no medical things that need to be attended to before they do their cleaning. Again,
I
do I
can
think
see
if
that.
again,
Yeah.
does it have to be a nurse? No, maybe there's a nurse on staff with housekeeping, right? That goes around and
Mhm.
just does that sweep. Because I do feel that nurses get a lot put on their plate,
I can
especially
see that.
when they find these um, cracks in situations. They do just put more on the nurse, which is tough.